Good afternoon, everybody. And realistically, I generally don't need a microphone. But can everyone hear me in the back? Okay, I really want to thank you for inviting me today. It's really a privilege to address you all. And as you well know, we are part of a nationwide march that is called the War on Women. Women United. This has been going on for centuries. This is our version 2012, and we're going to reignite. Now, I want to say, I think Alaska is an amazing place. We are the last frontier. We are very different. But guess what? We're a lot alike, like the lower 48. We have the same problems as they do, and we need to address them together. Not only as citizens of Anchorage that has the right to vote and have it counted, but to have our legislature and our governor support our needs when we pay them money. So, to make a long story short, I'm going to start with the personal. My name is Dr. Colleen Murphy. I am one of 9 children. My mother got married at age 19. She had 10 children in 11 years. Her third baby died at 7 months. My identical twin, Eileen, and I were undiagnosed. I was a breech delivery. And she woke up finding out she had twin girls. Needless to say, she went on to have 18 pregnancies. By the time she was 35, she had 8 miscarriages. I remember taking out her mattress every time she went to the hospital because it was blood-soaked, and we had to wash it off and dry it out because she had another unplanned, unintended pregnancy. This is real. I saw it. And this is what motivates me in my work. My mother. We're all mothers. Needless to say, my mother did not want to have another pregnancy. She sold vacuum cleaners to try to get an abortion in New York State when it wasn't available in Michigan. Well, she didn't need it. She miscarried again. And then, when she went to Pontiac, Michigan and tried to get her tubal ligation at a Catholic healthcare facility, she had to get my father's signature. She finally got it at 35. My mother went on to get breast cancer at age 43. My maternal aunt has breast cancer. My grandmother had breast cancer. Healthcare is a big deal for women. Now, I want to tell you, we need to act locally. We have to think globally. Right now, the United States is rated 49th in the world for maternal mortality. Since 1987, 6.6 women per 100,000 died in childbirth. It is now at 13.3 per 100,000 women. It has more than doubled in 20 years. Why is that? Why do we have a doubling of maternal death when we are spending the most money of any country in the world on health care, with 1 out of 7 women uninsured in the United States? Why is that? We need to fix this. This is a war on women. This is a war on men. This is a war on families. We need health care coverage for everyone. Very interesting. Amnesty International 2011 said it's a human rights crisis in the United States because of our high rate of maternal mortality. They basically said that this in their deadly delivery report. We are behind Bulgaria, Croatia, Macedonia, and South Korea. That's a wonderful distinction. The richest land in the world with the 49th maternal mortality rate. Needless to say, the healthcare community now blames the rising maternal mortality rate on older women having babies. Assisted reproductive technologies. We're getting fatter. More C-sections. Guess what? It is that. But it's also related to medical malpractice. It's also related to consumer demand. And women, you've got to take childbirth education again. You got to know what's going on with your body. You don't go into the hospital and get demanded induction in a primary cesarean section. Women who have repeat cesarean sections are having problems with their placentas and they're dying from hemorrhage. Women need to get involved with childbirth again. Nationally, there were 6.4 million pregnancies last year of 62 million women of reproductive age. 66% of them resulted in live birth, 19% were terminations of pregnancy, and 15% in miscarriages. Nationally, there were 1.2 million abortions in 2008. It has not much changed over the last couple years. 75% of them were surgical procedures, 25% were medical. In Alaska, 2008, we had 15,600 pregnancies within 142,000 women of reproductive age. What's interesting about that, we had about 11,300 live births, 73% of pregnant women, 11% termination rate instead of 19% nationally, and a 16% miscarriage rate. Alaska right now is basically running about 1,700 terminations a year. We only have 82% of our boroughs without an abortion provider. In 2005, we had 9 abortion providers, and now we have 8. We are going down. 52% of women who get abortions are less than 25. 5% are 15 to 17, and 93% are done within the first 12 weeks of pregnancy. Those are the facts. This is evidence-based. This is science. Behold, science. Now we get to the uninsured. Alaska has an overall 18% uninsured rate. Out of 676,000 people in 2010, 119,700 people were without insurance.
That's me.
And we are running over with money, thanks to the oil industry. 25% of Alaskan women are uninsured between the ages of 15 and 44. The CDC right now says that 56% of our teenagers are reporting being sexually experienced when they leave high school. Do they have a requirement to take sex ed in high school when they need it? No, it's done in 7th and 8th grade, and it's an elective in high school. 62% of teenagers report using contraception at their last sexual experience, and we wonder why we have a high teen pregnancy rate and high abortion rate. And last but not least, I do want to talk about how I discriminate. I'm really, really embarrassed to admit to you I discriminate. Basically, I have a little private practice with 3 to 4 exam rooms. The ladies shuttle in. I take their history, their age, whether they've been pregnant before, whether they want to be pregnant. I take their past medical history. I ask about cigarettes, tobacco, their family, do a physical exam. Then we do an assessment, and then I get to the hard part. It's called the plan. Because this is where I have to be really sneaky and look at the demographic field and see what kind of insurance she has, because I can't give women necessary care without money. And it really pisses me off, because right now I have to compromise care for women that need necessary services. And I want to say also that there's been a lot of controversy around transvaginal ultrasounds. You guys, let's embrace that word. Vaginal. Sing it loud. Sing it clear. Vagina. Vagina. Yeah, we have vaginas, okay? And they're wonderful things. You're not going to scare it out of us. The bottom line is right now, I'm going to give you evidence-based medicine. We have ultrasounds that can look at virtually every organ in the body, and it needs an acoustic window. It's like a submarine pinging out sound waves. And we've been doing it abdominally to examine the female cavities for years. But a transvaginal ultrasound, which is a probe that is smaller than a penis, easily goes into a virginal female. And guess what? You get better pictures, ladies. And it's less uncomfortable because your bladder's not full. And we can diagnose pregnancies over a week earlier. So we can diagnose tubal pregnancies. Tubal pregnancies used to be the cause of maternal mortality, about 15%. It's dropped to 8% because of sensitive pregnancy tests and transvaginal ultrasound. Repeat after me, vagina. There's There's nothing wrong with transvaginal ultrasound. And in particular, those idiots in the legislature who don't have a license to practice medicine. Amen. They don't even know we're already using it in abortion care. They don't even know it. The National Abortion Federation right now has basically requirements, recommendations, and options. And ultrasound is currently a recommendation. It's at the second tier. But virtually every abortion provider is now providing that because we want to date the pregnancy. We want to see how big it is, to see if the woman's a candidate for a medical abortion or surgical procedure. We want to see if it's a miscarriage. We want to see if, in fact, she has a tubal pregnancy. We use that to make abortion care and health care safer. And if you want to go ahead and force a transvaginal ultrasound, that's fine. But make sure you fund it.
Yeah!
And I just want to let you know, this is just part of another situation that's called TRAP laws. And this is targeted regulations of abortion providers. And what they do is they just keep on rising the bar. They have done things that say abortion providers need to have 20-foot ceilings. Okay? They're basically trying to put you out of business. So this is just another antic on the part of legislators to make abortion care supposedly less accessible and less affordable by introducing current technology. Last but not least, I do want to mention that there's been some concern around religious entities interfering with a possible national health program. And in particular, on a local level, we need to be aware that the Catholic healthcare directives are very much operational in our state. Currently, Providence, Alaska Medical Center, a 341-bed hospital, requires their medical staff to sign on to the Catholic healthcare ethics and directives, even though we never got a copy. Likewise, when I went to search your website last night, you could not find a link to the latest version, June 15th, 2011, of the Catholic healthcare ethics and directives. And let me just say that Section 4 has articles. And let me, okay. They're directives. They're numbered 38 to 54. And they all deal with us, women, okay? Okay, we're not supposed to have sex unless it's to make babies. We can't use any birth control other than natural family planning. Oh, and by the way, when you get pregnant, you can't get pregnant. You can't use any assisted reproductive technology. You can only get counseling and maybe talk about adoption. Article 45 says we need to be concerned about the danger of scandal in any association with abortion providers.
Anyway.
What about the priest? 52, Directive 52, may not promote or condone contraceptive practices. Directive 53, sterilization is not permitted in men or women. Did you know that about a Providence, Alaska Medical Center?
Yeah.
When you walk in there, you can't potentially exercise your full benefit package as a woman because you walk in there and you have to adhere to the Catholic healthcare ethics and directives. Truth in advertising. You can't find it on their website. 1 in 10 beds right now nationwide are administered by religious entities. And like I said, the medical staff bylaws currently require us to adhere to the Catholic healthcare ethics and directives, and they never give us a copy. So the thing I want to finish up with right now is I really appreciate the energy that was created by the Wall Street movement. We are the 99%. Right? And what I say to you today, we are the 51%, right?